muscle scraping my calf and shin pain? I've got the answers for you. If you aren't seeing results with the scraping tool and it's just sitting there collecting dust, there's a reason. You've been ineffectively using it wrong all along. It's not that you're scraping that will help you heal, it's how you scrape, where you scrape, and in what direction. That makes the world of difference. All scraping tools are welcome, but I love my ached away scraper, and it does the job so much easier with its vibrating and heating function. Check out my review video below in the description box and receive your promo code for a discount. All right, we're gonna muscle scrape for a lot of you runners or people who have like shin pain, calf pain, or Achilles stuff. They're both kind of one and the same. We're gonna do the same thing for both. So there are a couple muscles we are wanting, and we're going to inhibit first. We're gonna inhibit that posterior tib. That one always gets work. That's the piece that's right here. And then the gastrocs, these calf muscles, always get overworked. Now what we wanna facilitate is these muscles here, and then something a little bit more deeper, the soleus, as well as that lateral muscle. A lot of people feel tightness here, but it actually needs more facilitating. So dorsiflexion, or when your toes go up to you, are the key. So you want about 15 to 30 degrees. Life gets a lot better when you get that angle. So I have a little bit, but it's not as good as this side. So, and it feels a little bit restricted right around that front part of my shin bone. So, you know, they kind of become like a double-edged or kind of vicious cycle when both the front shins and the back calves actually work too hard. So we're gonna inhibit the posterior tib and the gastrocs first. So we're gonna inhibit. How you inhibit is you're gonna go away from that origin. So I can take that and I'm gonna, like I said before and many times, I don't actually have to push that hard because there's a vibrating and heating function. It starts breaking down that viscoelastic properties a little bit for me. And like I said, if you guys like this and want to try this product, use our discount code, get a little bit of a discount. And I'm a big fan of Ached Away in general. I'm gonna keep talking about it. They're not sponsoring this video, but I just love talking about it. So good. So we're gonna go this way, and that's it. Only one direction. Like, notice I'm not doing both. So I'm just doing that for a few times. How do you know things are going well? It's like running a vacuum across a rug, and then all of a sudden you feel it get really free, especially when you go past that rug, and it's the tile, right? It just goes vroom, right? So that's basically how you know things are going well. Like right here is a little more tough, more muddier, murkier, and then all of a sudden it starts freeing up. Good. And you might get bruising with scraping, just know that. Good. And then, so now I'm gonna go with the calf. Obviously it's a lot easier for me here. We'll get a close up, but we're gonna go away, and just this, like I said, bulkier, fannier muscles are great. And I'm just gonna kind of work only one direction, just straight down. So get that calf. Right here is a good spot, actually. It's not moving all that great. I got right there. And like I said, the vibrating part helps, that it just helps kind of break wherever it's stuck. There we go. Yep, so now that's a lot better. Oh, this one's pretty deep. So you can add a little force if you feel like it's kind of deep there, and then we'll just slowly drive that down. Good, 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 good. So that's just inhibiting itself. But let's actually take a quick kind of progress. And now that's feeling a lot better. That tightness I originally had here, much looser. That's great. But now we're gonna facilitate. So the big one is this one, just pulling it up towards the knee. And so I'm just taking this big, thin muscle that goes around the shin, just pulling it one direction. Good. Good. And then same thing here. You got, since you're right over there, you got that lateral peroneal muscles, or fibularis is what we call it. We're just gonna go right there, and it's a little tight there, so I can angle it a little bit and then just drive it upwards. Just really freeing this puppy up. Good, there you go. Much easier. And then you got the soleus muscle, which is kind of, if you want to take a look, it's probably more here. It does go underneath the
the calf muscle, the gastroc, but we're gonna work just this property. So we're gonna go right here and we're gonna go right underneath here. I can do this for y'all, but that's stuck. This one, soleus muscles is a postural muscle, and it's there for stability purposes for your heel, your knee. And boy, this guy is stuck. Oh, there we go. Now it's starting to move. Yep, look at that. So before it was kind of like stuck in the mud, right? And then there we go. And now you might feel as you scrape some like crepitus, it's like that little like jaggedy, bumpy stuff around your bone. That's normal, especially if you played like soccer or had a lot of stress by jumping, gymnasts, you know, those who've done dance. And then right there we go. All right, I'm done. So we'll get that, and I can tell you it just feels a lot better. I'm gonna definitely wanna do this other side. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter, not harder.